Hey Guru Nation, how's it going? We just did our SIV for the brand new site here in Yuma Clinical Trials. Camera out of battery, using a laptop. But I've got, you guys already know, Jaime Valles, right, nurse practitioner. And then we've got Kelsey. Kelsey,
hi.
You're new to Guru Nation. Can you kind of give people like a little bit of background on you?
Sure. So my name's Kelsey McKesson. I have worked in clinical research for 3-4 years, something like that now. I'm a monitor with Catawba Research, so I'm here helping get everybody started up with the SIV today for one of our studies. Super excited about it. Let's see.
Can you give people, okay, so Jaime's first SIV.
That's right.
What did you think? What did you think? Like, what's your takeaway on?
I love it because once you see the emails and you see the protocols, you have so many questions. And then having somebody present it to you, and then not only that, but be able to ask the questions real time and get the answers at this, at that time. It makes it easier to understand the protocol and kind of know what to expect once things move forward.
And Kelsey, so how long were you actually monitoring? For how long have you been a monitor?
I have not been monitoring for very long. I started monitoring in September, but prior to that, I was a clinical research coordinator for several years.
Perfect. So I always tell people the best way, we get a lot of people interested in becoming CRAs, so I tell them the best way is, become CRC first, do that for a few years. So how many years did you do CRC again?
I was a research assistant first. I was a research assistant for a couple of years in electrophysiology trials. And then I worked in pediatric oncology as a research coordinator for a couple of years as well.
Wow. So how do you like monitor life?
Monitor life is busier, but way more fun than site
Way
life.
more fun. How many SIVs have you done so far? Like, is this...
This is tomorrow when we do the other study, SIV will be my 4th SIV total.
Wow.
That I've conducted.
Okay.
I've done a lot on site.
So from a CRA... I think for sites, SIV is easy. I know a lot of sites get nervous about them. It's really, there's not much you need to do. You've already done most of the stuff prior to SIV. It's really just listening to the training. But for a CRA, I think SIV is harder, a little more difficult.
Well, it's a lot of prep work. So we have to know the study very, very, very in and out before we come on site, which is really tricky when you're first starting and you're trying to learn a new study and you don't get to do hands-on stuff with it like you do at the site. And there's a lot of documents that you have to have. So trying to figure out what all you actually need from the site so that you can make comprehensive lists and keep everybody organized is really tricky and takes a lot of time. So CRAs that are extremely organized will do well at SIVs.
And that's you. That is definitely you from my limited interaction. So any last words of advice for Guru Nation from the perspective of an NP doing an SIV or from a CRA doing an SIV?
Just keep on track. The best CRAs are CRAs that are friendly with their sites and form really good working relationships because otherwise nobody gets anything done. So.
And we've got a tough study, guys. We've got a above average difficult study, but we're looking forward to it and definitely doing more videos for you guys. Thank you very much, Kelsey.
Thank you.
And thank you, Jaime. If anybody wants to get a hold of them, LinkedIn?
LinkedIn.
Okay, LinkedIn profiles underneath. Take care, guys. Bye-bye.